Hi, I'm your host, Dr. Pooja, and this afternoon we are going to discuss a very important topic. But before we begin, I would like to tell the audience a general insight about what BabyChakra is all about. BabyChakra has been India's leading parenting platform and also a one stop destination for parenting for expecting moms and for new parents. Well, we try to connect with experts who bring valuable information and research based knowledge to this platform. On this note, we would like to kickstart with today's live session: Depression during pregnancy and postpartum. What you should know. And we have an amazing line of guest speakers who will be sharing their knowledge out over here. I take this opportunity to welcome our esteemed panelist, Dr. Padmaja, who is obstetrician and a gynecologist, Dr. Paakhi, who will be joining us soon for this live session, and Sharmila Devi, who is also a Lamaze educator, child psychologist, and a CBT therapist. I welcome you all and take this privilege to start the session for today. Dr. Padmaja, would you like to introduce yourself, please?
Yeah, I'm Dr. Padmaja. I'm based at Vijayawada in Andhra Pradesh, and I have been in this field for almost 30 years down the line. And I do a sort of specialty clinics is my feature. That means I take care of adolescents, I take care of women in their pregnancy, fertility issues, and deal also till menopause. So we have an overall view of the women coming in.
Thank you, Dr. Padmaja. Sharmila, can you introduce yourself, please?
Yeah, hi all. I'm based in Tamil Nadu and I'm a Lamaze certified childbirth educator. Also, I work on women's and with their families regarding right from pre-pregnancy up to postpartum and also with the childcare. Yeah, and also I'm a fitness coach and I'm a child psychologist. So I work along with all families to help them, and to my the work I'm doing is like to bring out the peace, to bring out the beautiful, to bring out the blissfulness in relationships. Yeah, I believe that works from birth. So that's my work.
Definitely.
Yeah, yeah.
Thank you so much for joining us over here today. We all know that depression at some point of time in pregnancy does cause a little problem. Whether it is during pregnancy, whether it is post pregnancy, we need to understand. So, starting with you, Dr. Padmaja, I would like to ask you a question. How can we identify a depression during pregnancy?
Most of the time, some amount of anxiety regarding the changes the body is going through are very common in women, and and the families are also very concerned, like especially in the first 3 months of pregnancy. There is lack of appetite, there is vomiting, so none of the food digest, everything is puked out, and there will be an amount of dehydration, some electrolyte imbalance, some level of low blood sugars. So all these lead to the woman feeling down, and
Right.
then the family is also concerned. Not eating, she's feeling so bad, is there something wrong? But we need to understand that there is a difference between what are the physiological changes and what are the abnormal changes. So you
Okay.
identify depression if a feeling of extreme lowness, not
Mm-hmm.
having the ability to enjoy what you were enjoying previously, and that is
Okay.
persistent for more than 2 months. So that is the sort of thing that depression happens. But depression is it can precede a pregnancy. So even people who are having these premenstrual severe symptoms and feeling extremely low, those are the people who have a chance of having such abnormalities in pregnancy.
Okay. Thank you, Dr. Padmaja. Sharmila, coming to you for the next question I would like to ask as moms. Are there any ways to overcome depression with the psychological therapy or, some exercises or something like that for a mother who is expecting and she is depressed?
Yeah. So before getting into a deep layer, what just wanted to give an outline how this works. Yeah. So everyone think birth is about only physical, just your body is giving birth, but actually it doesn't. The most work done is by physiological. The way you treat pregnancy, the how you go through your pregnancy, how you conceive, the environment, how you conceive, the environment, how you take over your pregnancy, how you give birth, in what kind of way you give birth. There are many traumatic births happening, yeah, right? So
Okay.
this birth can actually change the entire way of parenting and the future postpartum. Yeah.
Okay.
So while treating this as a physiological, psychological factor, there are many ways that we can avoid it. For example, everyone know this is your body, but what controls your body is your brain, the
Mm-hmm.
hormones, the
Mm-hmm.
whatever is happening inside your the baby growth, how you behave, everything is being controlled here. Yeah. So you can decide. There are like your brain is like a CPU, and you have the control over it. You have to decide what should happen, what should you think, and all those. That is like two things. Yeah, the brain controlling your body and you controlling your brain. So
Mm-hmm.
where the first thing, if it happens, that's where all the miseries happen, all negative thoughts, all those depressions, anxieties, all those everything, out of your voices, many hear voices. All these happen at the first, but where you take the control over, and when you control your brain, you know how to handle it. When you have a good knowledge about it, okay, this is happening to me. First, the recognition, this is happening to you, that will make a big change actually. So
Okay.
brain is like a kind of a mystery box. When you have the right key or right remote control, you can control it as the way you want it. Yeah, not as the way you
Right.
want it. Yeah, right. Also, well, this pregnancy happens, everyone, both the mother and the father get this kind of commitment, responsibility.
Correct.
So that makes them more anxious and anxiety. So it's I recommend, highly recommend, pre-pregnancy plan, yeah, or if possible a pre-pregnancy course or something where they could get knowledge what all would happen. It's not just a birth, or just you're bringing a living human being into this world, and you know how
Mm-hmm.
huge it is. But most of them doesn't realize it actually. Later they
Okay.
realize it only when they get the baby in their hand, but
Right.
that's too late. So I pre-planning or what is going to happen, especially your who's going to take care of the baby, how you both as a partner you share your caring for the baby, share your responsibility for the baby, financial aid, that's very very important. So all this planning is very very necessary for a healthy relationship with your partner and your baby both.
Thank you, Sharmila, for such a lovely insight. Dr. Paki, am I audible to you?
Yes, you are audible. Can
Yeah. Dr. Paki, I would like to ask you as a question to an expert. Like, does depression affect the growth of the baby? Would you like to share your thoughts on
you,
this?
if you would speak to doctor, even she can guide you about what happens is when you in your pregnancy, the preterm baby or your low birth weight. So secondly, give birth to the baby if in also the baby is all fine. Are in depression, there are a lot of yourself and your baby. I am speaking not just but as a person who has postpartum depression. Time
Okay.
you might feel are not good enough, you are not taking care of the baby. Times where I felt I was not able to, I was getting angry on the baby. Have I given birth? And when
Mm-hmm.
I came at that time, I realized the baby is not at fault. I a lot of emotions are disturbed. So it's a baby in your tummy, but if it's born, it can affect.
Okay. Thank you, Dr. Paki. Dr. Padmaja, coming to you. Most of the mothers feel like, I am going through this depression. Doctor might put me on a medication. But as a doctor, would you like to say that if the mothers are put on medication, would it harm the baby? So, what would be your thoughts on this?
The thing is, depression as such has, as Dr. Paakhi was telling, impact on of the baby in utero, because the baby is growing inside the mother. If the mother is not feeling well, the baby is not going to feel well. So if there
Yes.
is depression, if there is poor eating habits, if they don't take care of the nutrition, then the baby is definitely not going to grow well. And if they're not going to come to the doctor, have checkups, and look out for risk factors, it is going to be a complicated preterm birth, and the baby is going to be growth restricted. And some of the one of the biggest thing is suicidal ideation, and when they're feeling so low, there are even elements of intimate partner violence. So all these
Okay.
are the subtexts that are happening, and we should be alert about it. Not
Uh-huh.
just think that okay, this will pass off. So what are the things that are going wrong? What are the support systems that she's having? What is the time we are spending to it? How uh, cognitive behavioral therapy, emotional support her family is providing? All these, if that is not enough, then antidepressants, if they're necessary, they need to be prescribed. And there are
Okay.
medications which are comparatively safe, there are some that are not so safe.
Okay.
So that, and after birth, because this exacerbated, none of the medication should be stopped suddenly. If there is a person who has depression, if she has psychosis, if these medications are absolutely necessary for her to function normally, you should not say just because you're having a baby, stop all the medications. It should
Mm-hmm.
be a discussion with the doctors, with the primary care. If necessary, taper off. If necessary, continue the medications. And even in breastfeeding, very little amount of this goes in breast milk. Most of it, if
Yes.
throughout pregnancy, if they were using, it is not that giving breast milk is going to increase the drug. So they need to control the drug. So that is most important, because unless the mother is healthy, she is not going to be able to take care of that child.
Correct. Thank you so much for sharing these insights. Sharmila, coming to you, are there any exercises which help to lower the depression in the postpartum period so that that makes a mother feel better? So, can you just highlight on that note,
Yeah.
please?
It's not on a particular exercise or something. Normally, any body workouts or any exercise they would have followed or anything they would start new is prescribed because individual exercise might not help. If suppose I say that's one particular exercise, this might not support other hundreds of mothers there. Yeah, so each individual body has a great future features, yeah, right? So each one has to work out on which supports them, so they have to work on for. But basically I would prescribe is like healthy food. Three things are very very important. Healthy food is very important, healthy mind is very very important, and exercise, all to and also gut. Yeah, gut health is very very important, where they say gut is the second brain. When your gut is clear, your mind all is like already okay there. When your gut is not clear, when you have constipations, when you have many stomach issues there, already your mind is getting spoiled here. So maintaining your gut health is very very important. Having a good from the beginning of the pregnancy, having folic acid, good balanced diet. Yeah, all these are very very important. Regular exercises, any exercises, mostly I would prescribe for depression. I would prescribe a meditation, breathing exercise works, works heaven for many other moms. Just normal breathing exercise, not particular any exercise. If they want, yes, they can. Yoga, meditation, breathing exercise works a lot. When you know how this depression and exercise works now. Normally, this is your physic, yeah. So it all gets stored over. Body has lots of memories. So when you have to shake your body, you have to shook your body to get released out of it. It's like just dumped inside. You have to like shook the box to get the dump outside. Yeah. So that's how mainly it works. So yeah, at least a few walks, jogging, all these would really help. And yes, breathing exercise, it works wonders.
Okay. Thank you so much.
And I want
So
to
much,
add,
Sharmila.
I feel, just 1 minute, Pooja.
No problem, ma'am.
Calming mind, focusing, something like chanting of an om, these calm the mind and they do help a lot, because there are
Yeah.
very simple things that can be done. without any
Okay.
interference, without any noise. Just sit and calm your mind and focus on something pleasant. Even that helps a lot.
Okay, ma'am.
would
Thank
like
you for adding your
to I would
inputs.
like to
Yes, Dr. Paakhi.
I yeah add. So being a family gone through all of this, I tried on this earth. This ma'am, Padmaja ma'am, chanting, but the only thing that me was correctly all the mind. So I feel it is very important. One that keeps telling me that no, you're a good mother. This is what we rather than I know I'm really sorry you're correct about it, but then the feeling bad and all those make my mind. So, so exercise didn't help me, meditation didn't help me. Once I got the support system cheering me up, then all of this. So what I would suggest is you need all these things hand together, support system, people understand, then you can go for exercising.
Yeah, Dr. Paakhi, I was just coming to you about and talking about the support system. So, since you have also dealt with this in your life journey, so how have support systems played an important role for you? Were they mother support systems? Were you looking for support from outside, or was it within from your family?
So, to be very frank, as very nice. So she had we were mothers having children born in the very good support system. What happens in India when doctors tell आपकी बीवी को depression, partum depression है. I heard from my family, yes, मैं चोचले हैं बच्चों this, we don't want to do that. This is a mindset even after being educated. Me support mothers group that I went out, they used to be like the same thing. Don't worry. Yeah. So this is you might be good enough support system at your mother, may it be parents, even husbands are support. All three were not. That group of ladies were like, and the best part, even like all of them were babies. So we all were in thing up and we were alone to get all those negative thoughts. One is there, I used to is in my support group, someone or the other, or awake with a cry. So she could
Yes.
actually me. So I feel support system that we can have family members is where we can make such a group regarding the other techniques that tell us about. वो सब भी अगर बनाया जाए, even depression or any risk factor in that group, it's very uh, through this journey, because you might start in depression, anxiety for your baby. Female students
Okay.
have depression. Am I doing this? Doing this? कभी कभी trigger हो जाता है depression when he's not
Right.
being calm. Just start. There was a period of time my problem है. I used to get like, so this is what happens. So you need people who will always be there.
Thank you so much for sharing your insights. Now we come to the user end questions where the audience has asked us a few questions, and I would like all the three panelists to share your views one by one. So we have a question from a user named as Neha, and I would like the doctor to tell कि मैम मैं मेरा IAF my IAF has happened and it has gone failed, and the doctor
Yeah,
has said that she
and the
has Asherman syndrome. So, will I be able to get pregnant again? So, Dr. Padmaja, would you like to share your views over here, please?
yeah. The problem with the Asherman syndrome is in the uterus, the lining in which the baby should stay, that lining is damaged and the walls are sticking to one another. So this is a very
Okay.
unfortunate situation, and because that is the soil in which the embryo should grow. Even
Mm-hmm.
if we put in good quality embryos, the success rate, if Ashman's is there and a thin embryo is there, very few do succeed. Now there are some treatments where we do a hysteroscopy and stem cell injection into the uterine cavity, giving hormones, trying to get a good cavity. But this is a tertiary care treatment. You'll have to consult a doctor who has experience over the last 4 5 years in that, not just someone, because even stem therapies have their risk factors, they're expensive. It's not that
Okay.
it will work in some people if it is not a severe disease. Okay.
Okay. Science has advanced so much, so that definitely, I think Neha will definitely find a solution for this. Well, we have another user question, which I would like to say, which is open to everybody. How is open communication an important part when we are talking about depression with a mother, an expecting mother? Or so, Dr. Padmaja, would you like to share your views on this?
Just because I was having to speak on it, I went back to review the data that is there. They say that according to the statistics, because India don't have statistics, we quote American statistics. It is almost 10%. That means out of 10, one woman is having this sort of problem, and not recognized. And of the deaths that occur in the postpartum period, suicide depression is one of the leading preventable causes. Okay, so the recommendation is that we are looking after women. Not only are we just going to weigh their pulse, their PPA, their baby growth, and their anemic status, we should also be aware about how they are behaving, and including a watch for signs and symptoms will be a good idea. But we need to remember that this thought process also the response of women also, nothing is out of the way, because you know your body by then. You know that something is wrong,
Correct.
that I'm feeling so low consistently without trigger factor. So if they can say, I'm sure the doctors will respond.
Definitely. Dr. Paakhi, your thoughts on this?
Yes,
Importance of spouse communication?
I feel thing that can be tackled by the so जैसे हम normally about know the during pregnancy or diabetes. So we need to also with the husband, with the spouse. We need to let them know condition called as depression are like kind of signs in your wife, like she's getting swings and all of that in a journal. If you issue, then you can go to gynecologist. Now, scale and ask to identify if there is. So I feel it's very during pregnancy. Normally, introduce such risk factors or happen with the mother or baby, but that should be included. And shy away
Okay.
names and something, nothing like that. Just to know that might happen. Like we eclampsia, we talk about the issues that can happen with the the baby का low birth weight हो सकता immediately after birth. So we talk about that. We should also like then you go through that to identify utna day. So you don't have
Right.
to where you need medication and then by normal therapy.
Okay. Thank you, Dr. Paki, for your inputs. Sharmila, being a childbirth educator, how would you address open communication with its spouse?
Yeah. First of all, and I want everyone to understand what is depression. Yeah, many of them when they undergo it, they don't know that they are undergoing a depression. Like we have to identify between what is baby blues, what is depression, and what is psychosis. Yeah, baby blues are normal. It lasts up to birth, from birth to 2 weeks. Yeah, with mood swings, all those, first month, all those symptoms. Yeah, but depression is where it goes to an extreme level, where you have severe mood swings, keep on crying, excessive of crying, isolation, loss of appetite, insomnia, or sleeping to a large scale, either or having more food. I know that's where stress, control, addition with lots of food, your body become obese, and keeping body shaming yourself, and getting more stressed, yeah, fatigue, and not feeling very good, or isolating themselves. All these are kind of symptoms of depression. And for psychosis, it's like to an extreme level, where, yeah, suicide happens in depression, but psychosis, it happens in a more in a high rate. Where psychosis, they go like 5% of the experienced, those who are experiencing psychosis, 5% definitely they are getting committed suicide. So this is the statistics, recent statistics. So it's like a very huge number. It's just 5% for, but it's really a huge number. So, and 2 to 4% are in risk of hurting their own babies, their own infants. So, all these together, we are focusing only on women's, but there is actually father's depression also here. Yeah, where the society doesn't speak about it at all. And also here we are in a society where everyone says men are not used to men shouldn't cry. Men are very strong, so they don't cry or they don't get anything. That's not thing, that's not at all happening. So that's where the men go into a room and lock themselves up, where they don't expose themselves that they are depressed. No, I'm a lion, so I don't want to expose myself crying, or I'm depressed. No, that is not at all going to help. So even men's go into depression, even fathers go into depression. The PPD in fathers also increasing rate than the women's these days now, because our generation has seen fathers where they have not get into this childcare, sharing their responsibilities for the children, growing up their babies here. But in nuclear families, they now it is the responsibilities for both partners to equally share. But where they don't have any experience looking at their father, they don't have any experience in bringing up the child now.
Correct.
So they're getting
Correct.
into more of depression, where they don't have any idea of what is parenting. Suddenly, if you ask a man to go and parent your child, it's not going to happen. So society has to help fathers and normalize this depression, and normalize, bringing out what they wanted to say, talking, sitting to them and talking, and also taking therapy. Therapy is not for all the, I mean, there's a quote saying only these affected peoples or patients are meant for therapy. No, therapy is for everyone. You, me, every normal person can just go sit and talk, even with your a gynecologist, your pediatrician, or anyone, your mom, your anyone who could help you, who could you trust. You can just sit and talk. If the symptoms are no high, please go to a therapist, or please go to a counselor, get help at once. It's not like it's a great disease or something. Everyone these days, everyone gets into depression. And when treated initially, you have a happy family. You want your child to grow in a very happy atmosphere, right? So
Yes,
that is
Sharmila.
very important. Only if you are yourself, both the partners have treated it equally, you are very happy, your child is happy there. And also this depression mainly occurs for men, where men and women both, where they have no childhood traumas, or any other have they previously gotten into depression. They are in a high rate where they get the depression again during the postpartum
Right.
period. Yeah. So
Right.
what you have to do is definitely sitting and planning for financial aid for 6 months. And for the first 6 months, for the first month, who's going to cook, how you're going to get your meal, who's going to support you, your mom, bring in your mom, or anyone for from your family. If no one is going to support you, hire someone. If even if that isn't possible, just get help from community, where there are lots of nowadays these communities, they get in
Yes.
into parents, and they support a lot. So getting
Family
into the
support.
community sharing, yeah. So and also there's a huge increase in depression where when the sex life, it's getting fluctuation. They don't understand that this is normal. Yeah, both the women and the father side. So that is you have to normalize that also. And you also know have few four of the points, yeah, where you need, to prevent or even to getting off from the depression. The social support, that's very very important, where friends and family get in, the local support, or at least the online group. At least when
Correct.
someone talks, yeah, I'm facing this, I have faced this, I have met to this doctor, can someone help me? Or I need to, I'm facing this, can I meet a doctor? When you, or if you see someone typing, I'm into this thing, so you'll think, yeah, okay, so I'm not the only one, I'm not the only one I'm affected. There are people like me
Yes,
around me. So
definitely.
so it's okay to get depressed, but I have to treat it.
It
So
has to
that's
be
the where,
treated. Correct.
you get, yeah. And professional support, yes, definitely get into your gynecologist, keep in touch, check your body.
Absolutely.
Yeah, so when something is happening to you, your body is not obeying you, go to your doctor. That that's why they are there, to help you out. Yeah, only if you reach to them, they can help you out. Yeah, right. So
Yes, Sharmila.
gynecologist, pediatrician, primary care physician, anyone, or therapist, counselor, anyone, just go speak out. That's the thing. And practical support, yes, for the first month is going to be crazy. I tell you, it's crazy, because and those who have not yet experience, and first time moms and dads, you have no idea of what is going to happen, or even your baby doesn't know what they're going to do. All the long night awakening period, those fuzziness, all if your mood swings, when you have no support, all those things are going to help, put into you something. So when in following all this, if you even don't have a proper diet, that is going to affect you more. So
Yes,
that
Sharmila.
first month preparation of meal, that plan is very very important,
Very
plan of
important,
yours.
and that
Yeah,
has to be discussed with the husband priorly. So
yeah.
thank you for your wonderful insights over here, and thank you, Dr. Padmaja and Sharmila and Dr. Paakhi, for joining us for this live session, and where we could understand the difference between the depression during pregnancy and postpartum. Dr. Padmaja gave a wonderful insight. Sharmila shared wonderful views about being a psychologist and how support groups work in. Dr. Paakhi, gave her personal experience. Family support is very very important, and how she sailed through successfully in this journey. I thank each one of you. Your valuable insights have definitely helped the Baby Chakra mothers community. And there were questions from the users which were answered successfully. So thank you for your lovely time. Thank you for joining us in today. And for all the viewers, if you haven't downloaded the Baby Chakra app, what are you waiting for? Go download the app. These doctors are available for you. Use answer these questions will be appearing on the Baby Chakra app. The doctors are there to answer you and give you the kind of comfort that you require. So download the Baby Chakra app. And signing off for today, this is Dr. Pooja, the community expert at Baby Chakra. Thank you, everybody.
Thank you.
Thank you.